All right, we're going to finish up the overall number of problems you can have with the nervous system. In this case, more injury and disease type conditions that can happen, either the brain, the spinal cord, the peripheral nerves. Then there'll be one more short lecture on kind of specifics for nervous system disorders in children. So we'll start out today with bashing your head. Brain trauma happens a lot. People get in motorcycle accidents, they get in car accidents, they fall off their horse, they fall off the skateboard, they run into a tree while they're skiing without a helmet on. They also get beat up. And there's a certain amount of damage that happens through sports, especially contact sports like football. So we have a traumatic insult to the brain, some kind of bashing or stabbing situation. Start off with blunt trauma. This happens, this is probably the most often. This is where you fall off and bash your head on the ground. Sometimes it causes a depression fracture in the skull, but a lot of times the concussive forces inside the brain case, the caldarium, are just your brain being shaken back and forth and smashing against the sides of your skull. So you have things like concussions and intracranial bleeds and the like. In this case, even if you've torn the scalp off or even cracked the bone, the dura is in place. You haven't actually stuck something through into your brain. The damage can be local or it can be a lot more diffuse. Local, if it was a smashing force in one place. More diffuse if there was a greater amount of shaking going on, such as in a concussion. So here we have blunt force falling off something. Now you can be hit in the head with a 2x4 and the same type of thing will happen. But most blunt force trauma happens when somebody falls or gets hit in some kind of an injury situation. Here, this is a lousy picture, but it's sometimes the pressure or concussive forces will actually cause the eye to pop out of its socket. Sometimes serious, sometimes not. Often you can put it back in and it will work again. But you can wind up breaking the eye socket and having to wire things back together there. You're likely to get hematomas on the outside of the skull, so that's between the skull and your scalp. And those aren't serious, really. They look terrible, make you look like the Elephant Man. But in fact, as long as they're outside the skull, it's not a real problem. Here you see a little depression fracture. Here you see a couple of fractures, but still the dura is intact. There are a couple of kinds of things that can happen to your brain when you whack your head on something. The Coup and Contrecoup injury. The Coup injury is here. It damaged my brain right there. Contrecoup is the fact that your brain will rebound off the front and smash against the back of your skull too. And sometimes the Contrecoup injury can be as bad or worse. I mean, here if it's a bad bruise kind of thing, but here it hit hard enough that it actually broke a blood vessel, you have to look on the opposite side of the skull to see if the rebound effect caused a bleed, a hematoma. Here's the Coup, there's the Contrecoup. Happens a lot with bouncing type injuries where your head hits the ground or your head hits the steering wheel. Open traumas are where you get stabbed or poked with something. These can be accidental, they can be on purpose. The pointed sticking into your head type of traumas are more likely to be intentional, where somebody shot you or stabbed you or something. Generally, it's a focal injury. It goes through the dura and damages the brain right at that point. So here's a couple of examples. Here we have somebody that's been shot in the head with a nail gun. That's pretty nice. Here, a gunshot. the fragments of skull and the bullet are in there inside the brain, and this part of the brain is what is damaged. I don't know how this guy managed to pull that one off. Looks like it went in through the eye socket. Fell down and landed on it maybe, or else somebody really didn't like him very much. So if it's focal, you can see the problem. You got stabbed, you got hit, you have a hematoma, you have a hemorrhage going on inside there, and you can see where it is. The non-focal brain injuries are more like concussions, we'll talk about in a minute. And depending on where they are, they get their name. If it's extradural, okay, it's outside the dura. Well, it could be a scalp hematoma, that's outside the dura, or it could be between the dura and the skull. A subdural hematoma is quite common. Those seem to be, when somebody gets hit, it bleeds right below the dura. You've got this nice case around there, but there's damage to the blood vessels underneath the dura that are supplying the brain with blood. Subarachnoid hematoma is below the arachnoid layer, which means that it's in with all those little spidery legs area. There's a lot of blood vessels in there and a lot of cells that can be damaged easily. And if it's below the pia mater, it's inside the brain, because the pia mater is a cellophane-like layer that's right on the brain. So if it's below that, it's called an intracranial hematoma. Hematoma means blood tumor. In other words, just a blob of blood that's in there. It can cause you ischemia to the brain if the damage to the blood vessels prevents them from delivering oxygen to the brain. Probably more commonly, it causes pressure on the brain as that hematoma grows and shoves against the brain tissue. Epidural, outside the dura. Subdural, underneath the dura. Here's an intracerebral hematoma. It's inside the brain somewhere. Diffuse brain injuries are everything from mild concussions to shaking of the brain so badly it damages a lot of the axons inside the white matter and can lead to a persistent vegetative state. Mild concussion, a classical concussion is a bad concussion, and the diffuse axonal injury, DAI, is the shaking that can come from serious accident that causes the brain just to rattle around in the brain case, or shaken baby syndrome. You can produce that as well. A mild concussion, you don't lose consciousness, you just get confused for a while. The guy on the football field gets hit hard, he lies there for a second, and they ask how many fingers they're holding up, and sometimes he can tell them, sometimes he can't for a few minutes. Gets up and kinds of staggers off the field and comes back and plays some more. More often nowadays, they're being forced to take people into the locker room and check to see if they have a concussion, in which case they can't play for a certain amount of time because of all the head injuries, long-term brain injuries that have come from contact sports. Confusion, disorientation, momentary amnesia, can't remember actually getting hit. The stages, a little bit of amnesia for just a minute, and then, oh yeah, I know where I am. Momentary, a little retrograde, I don't remember getting hit. And if it's a little worse, stage 3, you're confused, both retrograde and antegrade. For the next maybe 30 minutes, you can't make new memories. You can't remember what happened after the concussion, not only slightly before it. But these are still considered mild in that the person doesn't go unconscious. They don't go into a coma anyway. Grade 4 is a real concussion, serious concussion. You do lose consciousness for up to 6 hours. So if somebody gets knocked out by definition, and they stay knocked out for, you know, any amount of time, not just like 10 seconds. If they actually lose consciousness, it's considered a classical concussion. Both anterograde and retrograde amnesia, they can't remember what led up to it, and they can't remember at least for a certain amount of time afterward. And often there's a post-concussive syndrome. They have headaches, they have memory lapses and stuff afterward for a while. My microphone is falling off. Diffuse brain injury, the DIA, is the whole next level. You can recover from this sometimes, but usually it means there was so much shaking, so much trauma going on that it didn't just stun the cells or cause local damage to cells that might recover. It actually broke axons. And the axons in the central nervous system do not regenerate. They don't find each other again. So an inertial effect, inertia means, you know, you're going really fast and hit something and it shakes so hard it breaks a number of axons. Shearing of the nerve fibers in the white matter in the center of the brain, and therefore the parts of the brain can't communicate with each other anymore. And depending on how many you shear, you either have something that you can recover from over time or not. Traumatic brain injury, often a deep coma, persistent vegetative state, inability to wake up. 90% of severe patients never regain consciousness. And spinal cord trauma is quite common. People are always breaking their back, breaking their neck. You get hit by a car, blindsided, rips your head to the side, breaks your vertebrae. You fall off your motorcycle. You fall off your horse. You land in such a way that it twists, breaks vertebrae, and therefore breaks the spinal cord in the place, or damages it anyway, in the space that those vertebrae were supposed to be protecting. You can have any kind of fracture of a vertebrae, just like any other bone. A simple fracture, you can see it, it goes through, but it hasn't deviated. You know, it hasn't displaced and caused a twisting or breaking or compression of the spinal cord. Simple fractures, least likely to cause spinal cord injury. My wife, when she got hit by the runaway truck coming down a hill that had lost its brakes, hit the front of her car head on, had her seatbelt on, but her head still went far enough forward to hit the steering wheel and snapped her head back and broke her top two vertebrae. But they didn't displace. As a result, she actually had zero spinal cord injury. She just had a neck that took a long time to heal. Compression fractures, landing hard on your tailbone. You can compress and actually crush a vertebrae, and it changes the length of that vertebrae and may push some material into the canal that is protecting the spinal cord. A comminuted fracture means that it's been broken in several places and now it's in pieces, often accompanying displacement to one side or the other, which is even the most likely to cause spinal cord injury. Most common spinal cord injuries are in the neck or the lower back. Your rib cage actually protects the thoracic vertebrae from moving very far. And so they're less likely to get whipped around and broken than the lower back and the neck are. Couple of ways it can happen. If you're hit from behind and your head snaps way back, you can compress the spinal cord. You kind of crush the discs between your vertebrae and cause a bulging forward into the canal here, and you have compression on the spinal cord. Minor compression might cause some damage that will repair once you repair it. Severe compression will cause damage that can't be repaired because it actually kills the cells or breaks the axons. Hitting and throwing your head forward causes a crushing motion on the front here, and yet once again the wedge fracture can cause a pushing back into the spinal canal. Compression fracture. If you hit this way and smashes one down on top of the other, there's kind of a wedge fracture compression. But this one, it's going straight down, and so material is going both fore and aft, and it's causing spinal cord compression. Here's a comminuted fracture. 3 little pieces you can see here. And this piece has shifted forward quite a bit as the result of being broken and displaced. Spinal shock is what happens to the spinal cord. If something happens to the spinal cord to cause it to stop working, either temporarily or permanently, this is spinal shock. I had a student in that class I mentioned where I was teaching people how to teach all these sports. And he was another really good student, a little bit older student, probably 30. And he had this giant scar down the back of his neck. And I asked him what happened, and he said, well, I was a competitive diver in high school, and shortly after I graduated, I went to this new facility that had just put in a brand new swimming pool, and they had a diving board, and I couldn't resist. I went out and dove into the water, and they had accidentally put the diving board in the shallow end. And he hit the bottom, broke his neck, and was quadriplegic. He couldn't move for a year. And suddenly it came back. You talk about a guy who felt like he had intervention from somewhere because he was convinced that he was going to be a quadriplegic for the rest of his life, and instead, here he was learning how to teach sports. So in that case, it was stunned but not killed. If it's killed, it doesn't come back. It's amazing that it would be stunned for a year. So when you have spinal shock, whether it's that temporary thing or more commonly permanent if it's a spinal cord, everything below that point stops working. Everything above still does. It's still attached to the brain. It's still got your cortex sending signals. So, you know, if you break your back here, you can still use your arms. Complete loss of reflex function. And one problem with this is if you damage your spinal cord, the signals that normally come in from your viscera through the spinal cord and up so your body can react to them are blocked. So you can't send the signal out, but you also don't have the reflexes, you don't have the input, so your body can tell what's going on with your blood vessels down there, with the stomach, urinary tract. You don't have the feedback, and so your autonomic nervous system thinks nothing is happening, and it can overreact in trying to stimulate these things because it's lost its negative feedback. And so this causes a complete whole new set of problems besides just not being able to move your legs. We've talked about this, spinal cord trauma. If it's below a certain level, you lose your legs. Paraplegia. You're a paraplegic. Quadriplegia. If it's high enough that it cuts off the brachial plexus too, quadriplegia. You have loss of your arms and legs. Or paraparesis, quadriparesis, if it's only partial. And the autonomic hyperreflexia is what occurs when your body isn't getting the feedback from your viscera and over sends out signals trying to cause a reaction down there. Extreme hypertension, sympathetic nervous system, can cause all your blood vessels to constrict, headaches, GI tract problems, and the like. Here's your autonomic hyperreflexia. Your inputs are stopped, your outputs are stopped, so the autonomic nervous system, which has branches that go outside the spinal cord, that come out of the cervical plexus and out of the, even the cranial nerves and stuff, are overstimulating the parts down here. It doesn't have to be trauma. Your vertebrae can just degenerate and collapse. There are a few different types of this that happen. People with osteoporosis, especially older women. People with any kind of bone degenerative disease, inability to process vitamin D or calcium, can cause a weakening of the bones and cause them basically to collapse. So you can have a collapsed vertebrae, which is called spondylolysis. Spondylo is another term for vertebrae. Lysis means to break apart. Spondylolysis, spondylolysis, is a deformation of the vertebrae that here has caused a shifting and probably extreme pain. Spondylolisthesis specifically is a displacement of vertebrae. The disc kind of degenerates and they collapse past each other. And spinal stenosis is anything that causes the canal that the spinal cord is going through to get smaller. Stenosis means smaller hole. It has gotten littler. And so it can happen because there's a crushing motion that pushes inward, or because you have a growth of bone inward that causes a stenosis at a particular point. Herniated disc will cause that, cause spinal stenosis, because it pushes into the canal and makes the space too small. Here's a herniated disc pushing dramatically into the nerves of the lower back. Now this is the cauda equina down here, so some of those nerves are able to just kind of push out of the way because they're not inside the sheath that they would be higher up, but still it's going to push hard on something and cause severe pain. A bulging disc just kind of sticks out some. This is actually a bulging disc right here. A herniated disc is where it has lost the integrity of the annulus fibrosus, the outside of that disc, and it has gotten weak and just bulges or kind of breaks the connective tissue so that it can form a balloon out there. It's not just getting weak and sticking out. If you have a MRI, you would be distressed to notice that everybody's got a couple of bulging discs in their lower back, especially if you're really active and athletic when you were young. Herniated disc. And a ruptured disc, specifically, the material inside completely breaks through and spreads throughout the area out here, and that's the worst. I mean, the more it goes, the worse it is. And they can go in and cut off these bulging parts. You lose, and they pretty much remove the pulp from the middle, and the top and bottom of this disc just kind of sit down on each other. You lose 1/8 of an inch in height, maybe 1/4 of an inch, depending on how thick it was. But you still have some material between the two discs. There's still a certain amount of movement. It works pretty well in a lot of people. Bulging discs through physical therapy a lot of times can be corrected. Herniated discs and ruptured discs, really not. There are certain things you can do to help relieve the pain, but you can't make this stuff go back in there very well. Another way of damaging your central nervous system, specifically your brain, although you can have a spinal cord stroke too. If you have a blockage in a blood vessel, you can have damage to the spinal cord, but it's most common in the brain. Cerebrovascular Accident, a CVA, is something that causes part of your brain not to get any blood. Stroke is the general term for it. Leading cause of disability, especially in old people become more and more susceptible to strokes. Our clotting mechanisms become slightly faulty. We're more likely to form blood clots. Our blood vessels get weaker. They're more likely to burst. Our blood pressure tends to go up, and therefore older people are stroke prone. The third leading cause of death in the United States. So that's a lot. That's a lot. Global hypoperfusion means there's no blood going to the brain at all. That happens if your heart stops. It happens if you stop breathing and no oxygen is getting there. It happens if you have a stroke in the brain stem area that's not allowing blood to move up through your brain properly. It happens if you have a complete blockage of your carotid arteries. So there are ways. This is a lot less common, except of course having your heart stop that's not all that uncommon. But then it's called a heart attack instead of a stroke for the most part. Ischemia means that you're just not getting oxygen into a part of the brain, a blockage usually of a blood vessel going to the brain. Hemorrhagic means there's a blood vessel that has now popped, probably had an aneurysm, a bulging weakening of the wall that over time got weaker and weaker, finally exploded, and now the blood can't go past that point and deliver oxygen to the brain. Thrombotic strokes are the most common blood clot that blocks a blood vessel in the brain. Now with those, if you catch them in time and deliver a clot buster, you can break it open, and if the reperfusion injury isn't too bad, you can likely restore a good part of brain function, especially if it's within that first hour or so. A thrombus is a blood clot that's formed in that area and blocks something. A embolism is something that came from somewhere else. A blood clot formed in your legs makes its way all the way to your brain and blocks something. It can be a blob of fat. It can be a protein plaque that breaks off from somewhere. It can be an air bubble. So an embolism comes from somewhere else but blocks it. A thrombus is formed in that area and blocks it. Transient ischemic attacks are often due to muscular vasoconstriction. It blocks it for a while, and the person has, it seems like a stroke, but then it resolves within minutes or an hour or something like that, and they have no sequelae. They have no problems afterward, usually. But people with TIAs are more likely to have real strokes, too. Hemorrhagic strokes are where you have a weakening of the vessel wall, it pops, and now the blood can't be delivered to the brain. You have to determine whether you have a thrombotic or a hemorrhagic stroke right away, because you can't give a clot buster to somebody who's already bleeding. It causes them to bleed worse, and you can kill them. So you have to look. Blood shows up bright silvery white on a CT scan. If you see a big area of white, you know that there's blood throughout that area, and you don't give that clot buster. If it's just ischemic, there's not going to be a lot of extra blood in that region. An infarction means tissue is dying, so the cerebral infarction happens where whatever kind of stroke you're having is severe enough and long-term enough that brain tissue starts to die. And a cerebral hemorrhage overall is bleeding in the brain. That doesn't necessarily mean you're going to have a stroke, because there may be, the circle of Willis sometimes provides another way for blood to get someplace. So you can have a brain bleed without having an infarction. If it's a true stroke, if you wait long enough, tissue will die. Cerebral hemorrhage can cause tissue to die if it blocks blood flow. More likely, it's going to cause pressure that's going to damage the tissue that way. Here are your aneurysms. A Barre aneurysm, saccular, it looks like a little sac. A Barre aneurysm, a part of the wall of the blood vessel got weak and forms a nice little round bulge. A fusiform aneurysm means spindle-shaped. The entire wall is weak and the overall blood vessel expands. Here's a Barre aneurysm sticking out to the side. They didn't point this, but this looks like at least the beginning of a fusiform aneurysm. Aneurysms don't heal themselves. Sometimes you can go for decades with one gradually getting worse and not know you have it. And then suddenly maybe it pops and you die, or you rush to the hospital and they try to do something about it. Hemorrhagic strokes are harder to treat. You know, a thrombotic stroke, you can put a clot buster. If you break the clot, then blood starts flowing again. The blood vessel's still there. But if you pop this, you're going to have to cut a hole in the skull and go in and try to repair the damage to the blood vessel without doing a lot of brain damage with your surgical instruments. But because it's already weak, the bigger it gets, the harder the blood pushes laterally against it. And so the harder it pushes, the bigger it gets, and the bigger it gets, the harder it pushes. So they're a cyclical, getting worse and worse and worse type of situation until they finally burst. Another way to have a vascular incident is to have a genetic malformation of your blood vessels. What you have are tangles, you have wads of blood vessels that interfere with each other, you have a bunch of extra blood vessels in an area that they tend to be weak. People almost never know they have these. I mean, how many of us have had a CT scan of our head to see if we can tell if we have a vascular malformation or some kind? Arteriovenous malformation, mixed directed blood vessels that can put extra pressure, not enough pressure, they can rupture. You can have a subarachnoid hemorrhage. Remember, the arachnoid layer has all those little feet sticking down. Lots and lots of blood vessels in there. You can have damage, you can have weakening, genetically weak blood vessels. And then you have a subarachnoid bleed, hematoma. If you have damage to blood vessels in your brain, or such a tangle that it doesn't let blood go to the right place, even though the blood vessels aren't breaking, you can sometimes tell. There are a couple of physical signs that you can do to tell if the person actually has a cerebral problem, or maybe they have a peripheral nerve damage due to a bulging disc that doesn't, they say, oh man, my leg is weak, it's not working, whatever. This Koenig sign, you bend at the hip, 90 degrees, and when you try to straighten it, the person exclaims in pain, and there's resistance to straightening. That turns out to be an indication of cerebral damage of some kind. And the Brudinsky sign, when you have the person lying there, even if they're not paying attention, when you lift their head, they move their legs. It shows that there's an improper signal getting from here to here, and that's also an indication that there's some kind of cerebral damage. Of a less serious, on a less serious level, we have headaches. Now, anybody that has severe migraines will not tell you it's less serious because it can be life-altering. If somebody in the middle of a severe migraine can't do anything, usually, except lie in bed and suffer. There are some treatments that seem to help. There are some medications that help some. Hyperbaric oxygen, sometimes. If it's a migraine caused by a dilation of blood vessels that's creating pressure in the brain, you go in a hyperbaric chamber, the high levels of oxygen cause your blood vessels to constrict, like they do generally throughout your body. And sometimes that will help people with migraines. But familial migraines, it's tough to determine what the problem is, what the real cause is. You know, stress will help bring them on sometimes. Sometimes bright lights and things will help bring them on, but it's really hard to tell what the underlying cause is. Otherwise, they could treat them a little bit better. Mostly women, genetic and environmental factors. Some people are predisposed, others are not. Usually the pain is on one side, severe. It gets worse if you move, so people will go and lie in bed. Nausea and vomiting sometimes. The pain is so bad. And a extreme sensitivity to both light and sound. If you're even talking in the other room, it'll drive them crazy, you know. So it has to be dark, quiet, you know, a time to recover. Migraines have a little bit in common with seizures. It's an overactivity in some way that is painful. You do have premonitory. You have a feeling that one might come on. You have an aura, you know, sparks flying around the room, lights around the objects you're looking at. Might last a few minutes before the onset of the actual headache. At least it might give you a couple of minutes to get somewhere where you can be as comfortable as possible. Triggers: overexertion, stress, bright lights, some chemicals. People have gotten migraines from MSG, you know, given headaches. Cluster headaches, amazingly, come in clusters. Headache, 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 headache. And then you won't have a headache for months sometimes. Long period of remission. These usually happen in men. What causes them? Not exactly sure. Kind of like migraines in that it is some sort of an overactivity of nerves, and in this case it will cause severe pain on one side, and on that same side autonomic stimulation that causes your nose to run and become stuffy, and your eye to water, and your eye to, you know, close with pain. And it's kind of a trigeminal sort of thing down this side of your face if it's on that side. It's ipsilateral because you haven't crossed over the nerves yet. it's still high enough that if it's happening here, the symptoms wind up being here as well. Tension headaches we describe as the kind that we get all the time when we're stressed out. I've been working too hard. My neck is so stiff. My shoulders are too stiff. And in fact, that's related to the true tension headache, which is actually a diagnostic thing of a type of headache that happens often for an extended amount of time and has certain signs and symptoms. A lot of pain, but a tight band around your head and maybe down your neck. Nuchal stiffness, it's the fascia down the back of your neck. It doesn't allow you to move your neck properly. You can have infections of the brain or the spinal cord. If it's inside the dura or arachnoid spaces covering the brain or spinal cord, it's called meningitis. It's relatively common. Bacterial meningitis, viral meningitis. Bacterial meningitis, if you take a spinal tap, it'll be cloudy. It'll have extra material in there and cells that aren't supposed to be there. Viral is called aseptic. It doesn't mean you don't have an infection. It means you don't have a bacterial infection. Sepsis, by definition, is a spread of bacteria, not of viruses. So aseptic or viral meningitis, non-purulent, so there's no pus involved with these. And you can have fungal meningitis. These can come in through sinus passages, very common in kids that have a lot of ear infections because your ear actually penetrates the skull and can take bacterial or viral infections inside the central nervous system. Nuchal rigidity, your neck is really stiff and yet it's not stimulation of muscles, it just feels super stiff. Signs and symptoms, very similar to the arteriovenous malformations. Brain abscesses means you have an area in the brain that is could be infected. It could be generally infected, an abscess. It's very well defined. It's encapsulated. It has a tendency to grow. Here we have a pretty good size abscess. It's distorting the ventricles. It's pressing on the brain material around it. You start off with neck pain and stiffness, nuchal rigidity. It can start, it depends on where it is. It can be motor deficits if it's in the area of the motor cortex, sensory if it's in the posterior part of the brain from the postcentral gyrus and back. If it's back here, it can cause damage to or compression on the visual centers and the visual association centers. So the signs and symptoms are based on where it's located. Most often caused by surgery to the brain that your brain doesn't respond really well and isn't entirely healed and causes a worsening problem in that area. It can be caused by an open injury of some kind that allows bacterial to get in there, bacteria. You can have a spinal cord abscess. Here's an abscess, fluid-filled, bacteria-filled, perhaps, bag. that is causing spinal stenosis. So you don't have your, here's a little bulging disc down here, but this isn't stenosing really, not like is being caused by the abscess in the spine. A lot of pain, numbness, motor problems. It depends on where it is. Spinal cord problems up here, hurt everything below that. Way down here is only the legs, only the legs. Greatest number of people have lower back pain. Your lumbar vertebrae provide almost all the movement of your back, and they're really susceptible to picking up things, to landing hard, because there's so much weight up here pushing on those discs. The term encephalo means brain. So encephalitis is an inflammation of the brain. Well, usually it's viral encephalitis. And so if it's meningitis, it's an inflammation of the coating. If it's encephalitis, it's actually an inflammation of the brain matter itself. A couple of specific encephalitises are caused by viruses carried in from flea and tick bites. And also the herpes virus, there's a lot of encephalitis that goes on with HIV, because HIV lowers your immune system. The herpes virus can burst forth and cause a variety of nerve problems, including, your brain is nothing but nerves, inflammation of the brain, encephalitis. So here we have HIV/AIDS. Now again, if you are HIV positive but controlling it, you shouldn't have signs and symptoms really. But if you don't control it and it becomes the syndrome, AIDS, then you have cognitive dysfunction. People lose their ability to think and communicate really well. It gradually deteriorates as these various mechanisms start attacking their nervous system, attacking their muscles. Myelopathy, myelo is the spinal cord, it means the center of, and myelopathy of spinal cord injury. Neuropathy, other nerves, a variety of nerves are damaged, the brain, the spinal cord, peripheral nerves. It's one of the causes of the muscle wasting, is the less and less you stimulate muscles, the more they waste. Part of it is from other mechanisms as well. Viral meningitis. Okay, so here we have attacking the brain, the nerves, the spinal cord, a lot of opportunistic infections and things too. A couple of final diseases that are specifically nervous system diseases. MS, multiple sclerosis. Well, sclerotic means hardening, so there are plaques that develop and stuff with MS. It is an autoimmune disease. Don't know exactly what causes it, don't know exactly what it is, and therefore it's hard to treat. Progressive, demyelinating in the central nervous system. Well, you take away the myelin sheath around these nerves, first of all, they slow down, and then it may allow them to stop their signal altogether. They lose too many ions in places that they're supposed to be insulated by the myelin sheath, and as a result, the nerve can't work anymore at all. You get a lot of muscle weakness. You get a variety of problems that would happen if your central nervous system has been suppressed that much. You can have spinal, cerebellar, or both. Cerebellar means you're going to have an ataxic gait. You're going to have a hard time with proprioception and therefore walking and balance. And it comes in episodes. You'll have, a bout of MS for a while, and then you get better for a while, and then you get it and it goes away. And things like stress tend to cause this. My best friend's sister-in-law, and when you get to be my age, you know somebody that has everything, has MS, and she's had it for years. Hers is pretty well controlled, but they've had some real stressors in their life lately, and they're really worried that it's going to bring back episodes and take her on the spiral course down to, you can die from MS, or you can certainly become incapacitated. At the moment, she's still working full-time. ALS, we've talked about this before. Amyotrophic, meaning no muscle building, lateral sclerosis, Lou Gehrig's disease, and it's an upper and lower motor neuron disease that affects the myelination, affects the activity of the nerves. It is so progressive and debilitating that most people don't live very long with it. Maybe 10 years or maybe 15 years, and they get worse and worse and worse until they can't even move, and it stops their respiratory muscles from working, and they basically suffocate. They get so they can't speak well, and it doesn't affect the brain. You can think perfectly well as your body is wasting away on you. And Stephen Hawking, as I mentioned earlier, he's the true rocket scientist that some people think is the smartest man in the world. He's lived with ALS for, 40 years or something like that. Really, really unusual. This is him when he was young, before it struck. Here he is now. He can't speak. He can barely do anything. He can hardly move. But he has a mechanism for communicating with the computer that has a voice in it that talks for him. Guillain-Barre Syndrome is an autoimmune disease, and it causes your own immune system to recognize your own nerves as foreign and attack them. The myelinating cells in particular are destroyed by your own immune system, and ultimately it causes paralysis because you can't send the signals down your alpha motor neurons, myelinated motor neurons, to your muscles anymore. It seems to be precipitated by viral infections, although they don't know exactly how. We know viruses affect your own DNA or RNA, and if you are predisposed to it, maybe a virus can affect some of your cells in ways that most people's cells are not affected, and changes them just enough that they start attacking your own nervous system. And myasthenia gravis, which means muscle weakness bad, grave muscle weakness, this is also an autoimmune disease. I told you that you'd think of autoimmune diseases, you only know of like 4 or 3 or something before you take patho, and by the time you leave patho, you know of 30 or 40 of them. It's remarkable how many of these diseases, it's not necessarily caused by the immune system, it's caused by some alteration that signals your immune system to recognize part of your body as being foreign. And so it's unclear in some cases whether the immune system has been altered, whether the target tissue has been altered so it now has antigens that are recognized as foreign, or what. But we produce an antibody against your acetylcholine receptors. Well, where are they? your acetylcholine receptors are at the neuromuscular junctions on skeletal muscle. Your acetylcholine receptors have to receive acetylcholine to turn that muscle fiber on. If you have an antibody stuck on all these acetylcholine receptors, your immune system then is directed to come in and attack them, and your acetylcholine receptors start diminishing. You get fewer and fewer and fewer of them. Here we have a normal, lots and lots and lots. You have all these nice little grooves that are full of acetylcholine receptors. The muscle motor end plate flattens out until it only has a fraction of the number of receptors that it's supposed to have. And therefore, you can't turn on the muscle. And it tends to start out in the face sags, the eye sags, you can't swallow very well, you can't speak very well, and then it moves and progresses until it can be lethal. You can't breathe or whatever. One thing that's interesting about this condition, though, is acetylcholine, when you send it down and turn this muscle on, at the moment you turn the muscle on so it contracts, you produce acetylcholine esterase. It's an enzyme that breaks down acetylcholine so it'll turn back off again. Because you want to not only be able to turn the muscle on immediately, you want to be able to turn it off immediately. So you have to get rid of that acetylcholine really fast so that the muscle can relax. If you want it to turn on again, you send another signal, or you send a whole bunch of them and you keep it turned on. But what happens is you break down the acetylcholine, it goes away. Well, what if, it's going to take the receptors being open much longer to get enough sodium in here to cause this cell to fire. So what you do is you give acetylcholine esterase inhibitors. So I only have a quarter of the number of acetylcholine receptors, but now the acetylcholine stays in there 4 times as long because it's not broken down as fast. Therefore, there's enough sodium getting in to turn the muscle on after all. And so acetylcholine esterase inhibitors are an effective treatment for myasthenia gravis. And as a result, people can tolerate this disease better than ALS or some of the others that don't have as good a treatment. Couple of tumors. Any part of your brain can grow a tumor. It can be a malignant tumor, cancer. It can be a benign tumor. Benign tumors in the brain are never benign. I mean, benign just means they're not cancers. But they can still squash parts of your brain to the point where it kills you or causes you to go blind or not be able to move your opposite side of your body or whatever. So just because it says they're benign, it doesn't mean that they're not serious. Meningiomas are tumors of the meninges. Something causes them to start growing out of control. It's not cancerous, though, but they can grow hugely. This is 2 different views of the same tumor. This is going to need to be removed if this person's going to have a life afterward. See how it's pushing the ventricles over. You can have tumors of nerve sheaths. Metastatic carcinomas mean it's breast cancer, lung cancer, pancreatic cancer, that the cells have metastasized, and for some reason the brain, unfortunately, is a relative receptive host to metastasized cancer cells from somewhere else, and it'll start essentially growing pancreatic cancer in your brain. By then they call it brain cancer, but it didn't start there. You can also have spinal cord tumors, meningiomas, gliomas, the glial cells that hold all the cells together, Intra and extradural, inside or outside, those are varieties of meningiomas. And that gets us through pretty much all of the things that can go wrong, the basic things that can go wrong with the nervous system. We'll follow it up by a short lecture on the ones that are specific to children.